Hello, Anne. Well, thanks for coming.
Thank you.
It's
Nice to meet you.
Thank you. Nice meeting you. I understand that you're here for liposuction and fat injection to the facial area.
That's right.
So what we will do, Anne, we'll just go through the procedure in details and explain to you what you are to expect through this procedure. The fatty transfer is a procedure where we harvest fat in a process called mini-liposuction from the tummy or the inner thighs, and involved fat transfer and purification. Once we purify the fat and we wash out the fat, we'll be transferring the fat to the area where you need it the most. And most of the people will need the fat into the cheekbone area and the mid aspect of their face. The reason is because that area there gives you higher volume and refresh your face. If you have a look at your face 10 years ago, you will see that you have much higher high bones than today. Unfortunately, the process of aging involved atrophy of the fat, which means the fat melts away, and also south migration of the fat. So we start to form jowls, the face start to become a square, as opposed when we're young, the face is a triangle. We don't have jowls and we have higher cheekbones area. So the purpose of this surgery is to rejuvenate your face, what I call a soft facelift. So a soft facelift involved three things. One is often liposucking the neck and the jowl area. Second is rejuvenation of the skin with either laser or skin peel. And the third is the fat transfer to the mid-face and cheekbone areas. So this is the liposculpture procedure where we do the procedure under twilight sedation. We make a small incision through the skin and introduce a cannula. And through this cannula, which is similar to this cannula that I have in my hand, we suck the fatty tissue. The initial fatty tissue has fat, oil, and blood. So with fatty transfer, we have to decant the oil and get rid of the blood and keep only the healthy fatty tissue. That process starts with washing out the fat. And then while the patient is asleep, we wash it, we get rid of the blood, we keep only the healthy fatty tissue. Then that fatty tissue will be transferred. You could see how healthy and yellow color. There is no blood in it, and there is no oil, mainly small fatty cells. This fatty tissue has stem cells in it, so it is a stem cell transfer into the facial area, and that will be clinically apparent by the improvement of the skin quality after surgery. The fat is transferred now to a smaller syringes using this fine cannula as I showed you before. So this is similar to this very fine cannula. And then the fatty particle that we'll be producing will be very fine fatty particle. The reason why we produce a fine fatty particle to prevent any nodularity or lumpiness. Big fatty cells have more potential risk of lumpiness or nodularity. Small fatty cells have less risk of any lumpiness. Then we'll be ready to inject these fatty cells into different area of the body. A very popular area where we inject the fat is, as I said, the facial areas. This is a patient while she's under twilight sedation. She had the fat injected into her cheekbone area. The red mark is a marking pen, it's not a blood. You could see through the skin with a little needle we inject the fat into different area. She had, you could see she's lacking fat into the upper part, into the mid-face area and to the jawline. She has a fat transfer to the cheekbones, the mid-face area and to the jawline. We reconstructed her jawline, mid-face and the cheekbones. She also had a rhinoplasty or a nose job, so you could see her profile has changed a lot significantly. Another patient, she also had a fat transfer to the, she is very deficit into the mid-cheek area, process of aging. We lose the fat and we have sagginess of the skin, so we managed to fill her whole face with fatty tissue. Do you have any question, Anne?
I do actually. How long does the procedure take?
About 1 to 1.5 hours, the whole lot.
Theatre?
In theatre, and often done under local and twilight sedation.
Yeah.
So you will be in a dream. By the time you wake up, everything is done. You will wake up, you have a little cut underneath your chin, no cuts, no scars on the face, and also a small little cut just to allow the cannula to go through your skin. Again, will be about 3 or 4 millimeter. So really one cut under your neck, one cut on the side of your tummy.
Okay. The next question is, what's the downtime? So if I wanted to go ahead, how long would I need to take off work?
12 to 14 days where you're gonna be able to go back to work and there will be no bruising or swelling. The first week, especially if you're gonna have the facial rejuvenation with the skin peel or with the laser, you're gonna be red in the face and will be slightly swollen. You're also going to have your skin peeling, so it will be slightly socially embarrassing to be outside.
Right.
In terms of doing daily activity, the day after surgery, you'll be able to go back to normal duties. Just going to be a bit embarrassing going out shopping when the skin is all peeling and red.
Okay. And it is just day surgery?
It is just day surgery.
How long does it last?
That's a very good question. The neck liposuction lasts you forever. The skin peel, we always advise people to look after their skin and to tighten their skin. The skin peel, we're doing it to tighten the collagen layer, which is the deep aspect of the skin, what we call the dermal layer. So by peeling the top layer, the skin will heal from the bottom up and the collagen will thicken and tighten. People need to do this maintenance treatment every 3-4 years, so we don't end up having a sagginess of our skin. In terms of the fat injection, 70% of the fat that we inject into the facial area will last you forever. About 20 to 30% will melt away. You will lose it, unfortunately. What you see at the 3 months mark is yours forever. Okay, so again, with the fat injection, we tell people, you keep in mind you may need a top-up injection in 2 to 3 years down the line. Initially, as an average for the face area, we inject about 15 ml each side. With the top-up surgery, if required in a year or 2 years down the line, we only add 2 to 3 ml.
Thank you, Dr. Barnouti.
That's my pleasure. Thanks for coming in.
Thank you.